We are in the final of the MAI Bangkok Business Challenge at SASIN 2016. We've had one team already who's presented. Next up is Team D Life from National Tung University from Taiwan. Please give them a big round of applause. Let me remind the team that you have 30 minutes, okay? And after 5 minutes, it'll become fully interactive. And then you'll receive 2 time warnings at the end, 3 and 1 minutes before the end. Please keep your eye on these beautiful ladies in front here, okay?
Okay.
So, and also please keep the mic quite close to when you speak.
Sure.
Okay.
Can everybody hear me all right?
Okay. So, yeah, we'll start the clock as soon as you start. Okay, good luck.
Thank you. Sawadee. My name is Uri, and I'm the CEO of D-Life. This is our team: CTO Shana, CMO Jolie, COO Bella, and finally our CFO Ian. Today, we're proudly standing here to tell you about our business plan. But before I go over, do you know there are 1 out of 11 people in the world that suffer from diabetes? Until 2015, 415 million of people were diagnosed as diabetes with a world prevalence of 9%. This population will grow to 642 million of people by the time of 2040, which make it the fastest growing chronic disease in the world. There are people who surround you, your loved ones, and even for yourself. This deadly disease could bring to serious complications if you are not paying attention to close monitoring. They can cause such as heart attack, food damage, and even stroke. However, current monitoring tools are time-consuming and invasive. Patients have to prick their fingers every day and increase the risk of infection. D-Life provides you a breath analyzer that's just like an alcohol breathalyzer with just 1 breath. Patient can know their condition by detecting the acetone level. And what is acetone? Diabetes are patients who cannot produce or react slowly to the insulin that regulate glucose level in the body. So your body have to burn fat instead. Acetone here is the byproduct of burning fat. A high level of acetone indicates a warning sign of dangerous condition of diabetes, which is why diabetics need our technology to know more about their condition before it's too late. The danger of diabetes is so significant that it causes 1/9 of world's Medicare. But yet, every 6 seconds, 1 person dies from it. The major causes are complication and poor control. D-Life offers you a non-invasive, accurate, and compact device with a smart care platform that's saving millions of lives and medical expenditure. So now to know more about our market, let's welcome Jolie.
So there are 2 main types of diabetes, type 1 and type 2. Type 1 diabetics cannot produce insulin, and they will die without insulin injection. Type 2 diabetes is associated with obesity and sedentary lifestyle, which account for 95% of total. Their body cannot react to insulin properly. Both of them need an easy operating and painless tool to manage their condition in case it's getting worse. Moreover, 193 million people have diabetes but still unaware of it. 380 million people are having pre-diabetes. It is essential to improve diabetes detection by providing pre-screening service. Therefore, there is opportunity for D-Life to enter the market by targeting 2 segments. First, point-of-care testing for those who are diagnosed as type 1 and type 2 diabetes to do self-monitoring. Second, prevention and early detection. We aim to provide pre-screening service to those healthy people who does annual physical checkup. Taiwan is our first market. We have better understanding of it, and also we intend to apply the success of a case to larger diabetes markets such as the US and China. There are competitors and substitutes for different market segments. For POCT, blood glucose meter and urine strip are main competitors. For PED, blood and urine tests are serving this function. D-Life deliver a comprehensive offering with our first product, ACE Analyzer. ACE analyzers uses an easy, accurate, and non-invasive detection. The data will transmit immediately to our smart care platform, which connects doctors and patients. And also, the systematic data we collected will benefit further research. Last but not least, we are eco-friendly. We can reduce the medical material waste. To know more about our product, ACE Analyzer, Strana, our CTO, will tell you more.
Now, D-Life packages sensitive equipment into compact device that able to detect low acetone level. That we suggest patients to use it before and after meal to monitor insulin's function. And according to personal health condition, that the users can adjust the frequency under professional instruction. There are three main chips in our device: the preconcentrator, microfluidic separator, and the acetone sensor. The process starts from the preconcentrator that traps the sample air, magnify the signal, and then through the separator where analytes are being separated into smaller pieces for these sensors to generate different electric resistance according to different concentration and then output the result. The precision rate has been tested and achieved 95%. D-Life also collects empirical data and build the acetone monitoring chart. That by this, that we observe there exists difference between the healthy and diabetes group. And the concentration can be further divided into three categories to indicate different health conditions. When diabetes patients' health condition get worse, their acetone level will elevate very quickly. And when they exceed 7 ppm, there's risk for DKA and complications. And if the condition is continuously unaware of and uncontrolled, that the acetone level will keep rising, and soon they will face a fatal critical situation. The analysis result will then be transmitted through Bluetooth to our mobile app and saved in cloud database. And D-Life Smart Care platform contains web as well that are available for users and doctors to log in and to keep track of health conditions. And next, our COO, Bella, will further introduce the operation plan.
So we do see the market needs and also the technology feasibility. Then how are we going to deliver our product and service to our customers? As defined, there are two segments as our target market. First, who are suffering finger prick. In Taiwan, 3.6 million people will need ACE analyzer, and we're planning to sell it at a pharmacy chain stores at a wholesale price of $250, and also provide the information on our website. Second, 6.4 million people will go to the medical centers for physical checkups every year. So we are planning to provide the ACE analyzer for medical centers for pre-screen and contract with them. 20% of examination fee, $5, will be our revenue.
Can you just answer one question?
Yes.
And then you can continue if you can.
Sure.
The wholesale price, so let's say the retail price is going to be 400
yes.
to 500. So the question I have is just what is the current cost for the current system of pricking, you know, the finger in that? What is the cost to them? And how does this compare to that cost?
So for your questions, currently we have to prick our finger through blood glucose meter, and the current cost is for blood glucose meter itself is around $70 in Taiwan, but they have supplies. So for a year, the cost is around $700.
And then what's so this cost of 500 you're saying is lower?
It's much lower, as they need to test with a strip, not the device itself.
Okay. And how long does the device last?
Actually, we are planning our device. You
Yes.
mean? We are planning to. We are still going to the commercialization stage. So we are testing, but we want to provide at this 1 year warranty, and also keep developing and improve. We are sure that everything that customer needs will be more.
So that brings to the next question, which is that it's hard to believe about this technology because it would be a major breakthrough and a major thing. Let me ask you, who else is pursuing this type of technology? There must be companies out there that are trying to come up with a solution to pricking finger for blood.
Sure.
Yes, as for, of course, there exists other companies that they are trying to use a non-invasive way because it is the trend for non-invasive detection. So that this just shows that we are on the right trend. And then, of course, as you see on the screen, that there are some some examples that, for example, there are technology that's use the electrodes that patch on your skin and use electrical current to penetrate your skin to measure the blood glucose level. Or there are the technologies such as eye contact lens that has sensors to detect the tears that in your eyes. But whether it is truly non-invasive or invasive.
Those examples are not really comparable. I'm saying who's coming up with your technology. You've shown a pretty simple diagram of the the output that's coming out of your body in this case. You must not be the only one doing this specific thing.
Yes, of course. We have our own research team, and we have experts that have been in the VOC gas detecting field for almost 20 years. And then he's a very experienced researcher, and so we have a really strong research team. And then we do this project for a year right now.
Yeah, not to scare you, but as a point of clarification to follow up his question, I happen to know that Johnson & Johnson internally says there are probably 800 to 900 companies currently working on non-invasive diabetes identification. 800 to 900. And that's just Johnson & Johnson because, as you realize, they are the biggest in the market, as you pointed out in your presentation. So you have plenty of competition. Not to scare you, but just to clarify, this is a tough market.
Yes, of course, we realize that it's a really crowded industry and there are a lot of strong competitors out there. But what we see are the potential of technology is that actually our technology can be used to detect very low concentration compounds that from our exhale breath, and it can be really applied in the medical field.
Can I ask, medical field, which one of you work in the medical field or have worked in the medical field?
Our advisor, one of the
Sorry, you.
For the management team, there's no one, but
Correct,
for the advisor,
correct.
there's
So what I
doctors.
see is the first thing that makes me concerned about whether you can execute this is that none of you have worked in the medical field. So can you answer the question about how you can convince me that you can execute this plan without any experience in the medical field?
So at the moment, actually, we have already have a connection with several hospitals, such as the
Zhongshan Hospital.
Zhongshan Hospital. There's an advisor, one of our advisors. Actually, he's a doctor, and he's expertise in diabetes. And we have talked with him about our idea, and he's pretty positive about our potential, actually. And also, we have the budget and also try to recruit as many as professionals in our team as well.
What's the current status of your product? Is it under development still, or is it clinical testing?
The current status of our product is that actually we finished the first generations of prototype development in our laboratory, and
What do you mean by first generation? Sorry.
Because that, as you can see on the screen, that the left picture is our first generation prototype, and it is like this big, and because we 100% handmade, built by ourselves. So, but we already successfully built the 3 core chips already, and so we are developing the second generation prototyping, and to expect that we can compact it into like this small size, and we expect to finish the second generation prototyping by the end of this year.
And after you finish that, how long does it take from then having a prototype to actually manufacture it and getting regulatory approval, doing clinical tests, and all those until you can actually go to the market?
Okay, to answer your question, you can see the timeline here. We are planning to finish our prototype, as we say, that before the end of 2016. And then we will go into the clinical trial and also other applications such as FDA and also the GMP for manufacturing. So we are planning to launch our product in 2018, the third quarter.
Well, I would like to hear your comments about the paper that I'm going to read for you, okay? February 2015, there was a journal published by, I think, the Diabetes Technology Society, okay? And it says that sometimes there is a negative correlation between blood glucose and acetone. But in your case, it's always positive, right? Okay, that's one thing. And his conclusion is that it is well known that the concentration of acetone is influenced by many things, okay? But he said that much more complex analysis with long-term measurements are required. And presented results should be regarded as tentative. And validation studies and analysis and clinical tests in a large number of patients, including control groups, need to be carried out. Can you comment on that?
Yes, I think that you bring a very good question. That the reason why there's such researches that they claim that there's negative relationship between acetone and blood glucose level is that because all this research, they are so scattered. They are spot research. They didn't consider the variance such as time, such as whether the patient has having meal or not.
I know, but given that kind of research available, okay, how are you going to sell your products?
I think this is right now at this stage that we collected the empirical data and eliminate the bias that we built this chart. And the next stage of our research is that actually we want to find out the causal effect between the acetone concentration and the blood glucose level. And under the controlled variant, we want to find out the linkage. And then we can establish the standard of acetone concentration so that the doctor can base on this standard to give as a guideline to give patients further medical advice.
That one you show me again,
Yes.
second time. Okay, this one is not consistent. You see, some is healthy, acetone level is so high, some is type 1 is level of acetone is higher than type 2, something like that. That is not consistent at all.
Actually, what we're showing you in the business plan is the overall chart. But of course, it is just a very simple chart, and there are a lot of statistics work behind this. But we are presenting all the examples that we collected and showing you. And of course, the bias that you said, it's been eliminated through the in the statistics analysis.
So I guess the premise, the attraction of this product is actually simple, easy to use for a home-based user, someone who, like a grandparent, could understand, right? But then you come up with this chart, the question that the other judge was asking. It seemed to me that there's supposed to be much more complicated analysis before you actually determine whether there's a problem. How do you rationalize those two between a simple homemade tool that immediately tells you whether you have a problem or not versus something that's much more complicated that needs doctor analysis, which in the end the patient will go to the hospital anyway?
Before you answer that, just quickly, I want to hear from you on the end. You haven't had a chance here, so let them answer this judge's question, and then let's have some input from you. I'm not saying you have to answer this question. The young lady that was going to answer, it's fine. I just want you to participate in this because we haven't heard from you yet, and I'm interested to see what value you add to the team.
I'm the CFO of Delight. Yes.
I'm sorry. So actually what we're presenting here is the technology of these 3 chips that we are able to detect very low acetone level from our Excel breath. And of course, this is a lot of work behind like analysis and the research. But for users, they will get the result of that is very intuitive. They're easy to understand. But of course, for doctors, they need a more comprehensive report that will support their medical decisions.
So the device, does it have like a green light, red light, where it says that red, you have a problem, green light, you're okay, you have no problem, red
Yes.
light, go see a doctor today or something like that?
Yes, of course. We make it like really simple for the users to understand easily that about their health condition.
Because the question from the other judge was, acetone may or may not relate to diabetes, and you track acetone. And how are you going to determine whether the person has a diabetic problem or not? I still don't quite understand that relationship.
So according to our research, we already found that there is a significant difference between the healthy and diabetes group. And so in our next phase of R&D research is that we want to find out the linkage of these two. But that requires, of course, large-scale clinical
Can
trials.
you answer another question, which is, have you seen this research that he raised?
Probably not the specific one,
Okay.
but I've read another
So,
research.
would you consider contacting the person who wrote this research?
Of course, of course.
Because I think that that would be a good way to try to address this issue. You know, sometimes we have to take opposing views to make sure that we're testing the risk of our view.
Agree, and totally agree. And I think, like, you know, we're here as investors or as representatives of investors. We're looking to invest in a business, not so much a research project, which now it seems to be something of.
Okay, tell me why you're here.
Based on the based on the right technology and the right market, I'm responsible for the marketing projection. I'm responsible for the financial projection. Sorry, and the reason why I'm here is like after the technology and the marketing and the operation plans, I will show you the 5 financial highlights and tell you how much we are asking for support and how much we are what kind of things we are going to offer.
Well, I can tell you before you do that 1.6 million US would not pay to get you the approval. So if you come into the US market, the 40% that you're offering for 1.6 would pay part of the bill to get you approval. But it wouldn't pay at all. So I question the financials from a US investment standpoint.
Yes, we understand, but now we are focusing on the Taiwan market because we are familiar with the regulations and there's a place where we're from.
Can you explain a little bit more in terms of how can you reach cash flow positive in the third year after raising fund right now? Since basically you're going to take another 2 years to 3 years to actually test it and then getting regulation before you can actually go to market and sell it.
Yes, now we are offering a disruptive technology, and we know there's a time for the customers to accept our products. And for the financial parts,
When are you launching the product? I thought it's
We're
2018, the third quarter. So you can see the cash flow here. Actually, we can get the positive cash flow in the in 2018.
Where do you plan to sell and how much you plan to sell in the first year?
In the first year, we are going to launch as the business model. Actually, you can see on the screen. We are selling 2 roads. One is to the end user, which is diabetes, who needs to pre that finger. We want to provide a better method for them. And we are selling at the pharmacies. And the second is the service we mentioned before about the pre-screen. And we are going to provide it to the medical centers because there are a lot of people who have the healthcare awareness already and then willing to pay more to do the physical check. And also in global, there are still 45% of population are still undiagnosed.
From the investment that you're asking, which is 1.6 million, that would cover the regulation approval,
Yes.
the patent filing, the R&D,
Yes.
research and clinical
Yes.
research, as well as marketing, as well as salary and hiring other medical professionals, as
Yes.
well as distribution channel and all the commission that you have to pay.
Yes, for now we are planning for the $1.6 million is for before we launch our product. So everything will be covered, as you mentioned, like regulation and the channels and the contact and the clinical trial as well. It will be
What
all
about manufacturing and all of So
Right.
you have 2 phases to this project.
right.
Phase 1 is development until you get to the time 0 where you can say, we're going to be able to start selling. We've got approvals and everything.
Yes.
And then you have after that time 0 where
Right.
you're going to have to construct the product and distribute it and sell it.
Yes.
How much funding do you need from now until that time 0 when you assume that you get approval? How much money do you need for that phase?
1.6 million.
So how much money do you need then to go from that point when you've got approval to actually scale it up to sell the millions of units that you're talking about selling?
Actually, this plan is going to, based on our sales forecast in the first year. In the first year, we have the market acceptance.
So you're saying 1.6 million is going to get you all
From
through
now.
the period of time of getting approval and through the startup phase until you're cash flow positive. So it's only going to take 1.6 million to do this whole thing.
1.6, I should rephrase that it's from this point to until we are ready for launch. And actually, we have the initial capital already to do our R&D.
Okay, so tell me, how much capital do you have then for the initial?
The initial capital is around $2 million.
So you have
Around $2 million.
So you have $2 million to get you to the approval date.
So to now.
We will have $2 million for us to finalize our second generation product and go to the clinical trial. But this money cannot support all of the clinical trial process. Therefore, we are here to see.
So you're already spending $2 million right now. Is that what you're saying?
Yes.
And so you're going to run out of that at some point, and you need 1.6 million to carry you through the rest of the clinical trials.
Exactly.
Yes.
And let me ask you, when you started spending this $2 million, did you think it was going to get you through the clinical trials? Are you over or under budget on that?
For that question, we did calculate all the money that we needed. So we did anticipate that we wouldn't get not as far as we anticipated. So we still need 1.6 money to carry us to complete the clinical trial until we can launch.
How long is the $2 million last?
It can carry us until the end of this year.
And
Since last year, we estimate
Yes.
our team.
And who's funding that right now?
From our family and also from our friends.
On your sales figures, right? You had the market POCT and PED, right?
Exactly.
So I had two questions. So for each of the markets, right? So one, for POCT, as I understand it, you had like a figure of 3.6 million.
Correct.
I'd like to understand that figure. Is that total diabetics in Taiwan, or is that diabetics actually using the pricking finger today?
Total diabetes.
And how many people are using pricking finger today?
Actually, everyone should be using the
Should be, but how many
should
are
be.
using?
60%.
60%
Yes.
of that figure. And then, so how many percent, as a figure, right? By 2020, you're saying 182,000. How many percent of that percent that's pricking figure today are you expecting to convert?
We didn't calculate it, but we hope that because it always takes time for customers or a consumer to accept the new method and technology. So actually, the market acceptance is pretty conservative, but we try to do more and promote more and to prove that this technology is really better for the customers.
Okay, so that's my first question. Second question is on PED, right? Pre-screen usage. So initially, I thought the POCT would be your main market. Now,
Exactly.
the PED, you said, am I reading it correctly? Pre-screen usage, 287,000. That means the majority of the units would be sold to the PED. Is that accurate?
This is for the examination.
Yeah.
So the service.
Right.
So the number the number there, the usage is the people, the population to go to the medical centers for physical checkups.
So where's the unit sold for PED?
We are not selling the device. We are planning to provide the device to the medical centers and then contract with them about the whole program.
Right. So you're providing the device for them, and
Yes.
then you're getting some revenue share.
Yes.
So the question I have is, because the existing hospitals, they definitely have an existing equipment that checks these products, which is probably more accurate, and probably they've already invested in because they've spent their capex on. Why would they acquire an additional equipment, and why would they share revenue with you?
So actually, this should go back to our technology. We are going to provide the non-invasive. As you say, there are a lot of
Correct.
methods.
So your graph here, if I'm reading it correctly, it says PED, collected sample is urine. To me, urine is non-invasive, correct?
Urine.
Your graph here in 2.3, right, it says hospitals, clinics, laboratory. PED market, it uses urine. It collects urine and it...
Yeah, but for urine test, they need a week. Yeah, they test the urine, but they need another week to wait for the result.
Correct. So the
But we
thing
can
is not non-invasive. It's the same, correct?
Yeah,
it's
but-
speed. You're saying it's speed.
But it's time consuming.
Time consuming, correct.
Yeah.
But the other point that I wanted to point out to you is that the cost for your test is $450, right? Or I don't know how much it'll cost. But the cost at the hospital right now to check diabetes is only $3, which is not expensive, correct?
For the device, It's 450. It refers to the glucose meters and also the strips, actually.
So how much would a hospital charge based on this projection for a diabetes
So for
test?
the examination fee, we are planning to charge $5 based on the regulation and also the healthcare industry in Taiwan.
So
because
people-
we cover most of the medical expense and we can go to the doctor clinics for only $5.
Right. So hospitals have to choose whether they want to share revenue with you, and then patients have to choose whether they want a faster product, but
And-
maybe double the price, correct?
Right. Actually, for diabetes, who choose to buy our device will be the daily monitoring. So they can get the condition control every day and 3 times at this.
Correct, but you're saying if they go to a hospital, if they want to use your device, they have to pay double the price what they're paying today, correct?
$5. No, I should rephrase that. The $3 should be the fee to go to see the doctor. But for a physical checkup, in Taiwan, average every year, people spend on it. It's around $300.
I'm afraid our time's over. Thank you, D-Life from National Chiao Tung University of Taiwan. So we'll take another short break.
จบไปแล้วครับนั่นคือการนำเสนอแผนธุรกิจภาคภาษาอังกฤษทีมที่ 2 ของวันนี้นะครับจากทีม D-Life ซึ่งมาจากมหาวิทยาลัย National Chiao Tung University จากไต้หวันนะครับ